76.4% of Americans are living with at least one chronic disease: cancer, heart disease, diabetes, autoimmune disorders, the list goes on. And if you're living with one of these, you know how devastating it can be. The fatigue, the pain, the emotional toll. It reshapes the quality of your life in ways most people never see. But here's what's hard to ignore. Over the last 60 years, these diseases have exploded. And as more people have woken up to that reality, the blame game has exploded with it. Big food, big pharma, the medical system, the government, everyone is pointing fingers. And honestly, a lot of that criticism is warranted. But outrage alone isn't enough to solve this. To fix a problem this big, we first have to understand it, and that's where things are breaking down. Fact has been mixed with fiction, and that confusion is only hurting us. People are left overwhelmed, angry, or afraid without a clear path forward. If we're ever going to take back control of our health, we need clarity. That's why we sat down with Dr. Jessica Nurick, a public policy expert and registered dietitian with a PhD in nutrition science, whose work has exploded online to more than 1.3 million followers. She's become one of the most trusted voices, cutting through the noise, debunking bad science, and helping people understand what's actually driving our modern health crisis. If you're new to Mighty Pursuit, we exist to help you make sense of the whole person, mind, body, and spirit, not as vague wellness cliches, but as deeply interconnected parts of your everyday experience. And in today's episode, we zoom into physical health. And by the time we're done, you'll understand what's really driving this crisis and what it takes to reclaim your health, your energy, and your life. So let's get into it. I had to double take this, but if you look at the numbers behind the chronic disease epidemic, it's brutal. Yeah. I mean, the CDC reported in 2023, this is really 76.4% of US adults have at least one chronic condition. That's many different things. And in 2025, the US spent 4.9 trillion on healthcare, which is so far outweighs basically every country. Obviously, we have a lot of people that live here, but then if you look at a per capita basis of how much is actually being spent per person versus other countries, it's double or triple.
Yeah, it's double the average of OECD countries, the highest income country. We have a food environment that's really set up for many of us to fail. We have a built environment that's set up for many of us to fail in terms of physical activity. And so our systems are really failing us.
Yeah, when you say some of the systems are set up to fail, set up for people to fail, I want to kind of break down that, because I think a lot of people have internalized over the past few years with all of this awareness that there are some large systemic forces that are kind of working against them.
Yeah, so our entire food system, you have to understand, is built for profitability at the expense of our health. It's not necessarily, there's a narrative out there that it's intentionally built to make us sick. It's not. They just don't care if we get sick or if we're healthy, because the goal is profitability. So from the food we grow to the food that's marketed and sold, there's always this idea of putting profits first. That's the primary value, right? Profit and growth. And so if you think about the food we grow, the entire reason that we spend so much in terms of what we're subsidizing and the crops we're subsidizing, which is largely corn, wheat, and soy, which are what we term commodity crops. We call vegetables and specialty crops, which is kind of sad. But yeah, the entire reason that we subsidize that and why we have really incentivized farmers to grow a single crop is for efficiency. Because it's a lot more efficient to grow corn on a big cornfield than it is to grow or have a farm with 20 or 30 different crops, right? That are diverse and that you're turning over all of the time. So we decided this is much more efficient, and this was decades ago in the 70s. So let's start really incentivizing farmers to grow a single monoculture, so corn or wheat or soy, and that made those crops cheap. A lot cheaper relative to something like a specialty crop. And so food manufacturers are looking to maximize profits. And if you're looking to maximize profits, one of the things you're going to do is look to cut costs. And how do you cut costs? You use cheaper ingredients. And so if we as a government are subsidizing corn, wheat, and soy, you're going to start using the corn, wheat, and soy, right? So you're going to start, if you need a sugar source, if we have quotas on cane sugar coming into the country and we're subsidizing corn, so it makes corn much cheaper, we're going to start using corn as a sugar source instead of cane sugar, and we're going to use high fructose corn syrup in a lot of our products. And so that's one example of how they're just cutting costs. And so, that has incentivized food corporations to use a lot of these products in their food And that's just one way that corporations cut costs, right? The other thing that they try to do is obviously in a food environment that has so many different options, they have to set themselves apart. And so they have to spend a lot of money on marketing, and we don't really regulate marketing. And so specifically, they spend a lot of money marketing to children and to low-income populations. And so we don't really have any kind of regulation on that. They look at there's studies on grocery stores and where they position the food. So they know exactly where to position some of these foods to get more people to buy them. And again, the goal is to get more people to buy them. There's good evidence to show that if there's a combination of salt, sugar, and fat, any two of those within combination of these foods, it'll get people to eat more of them. And so, that's what food corporations want you to eat more of their foods. And so they're going to do those types of things. And so that's really built this food system. And from our agricultural system, in order to get those huge farms that were much more efficient, it really decimated local food systems. And so now we have a food system where we're heavily reliant on kind of these prepackaged, ultra-processed foods, shelf-stable foods that will last a long time, right? That don't go bad really quickly because we don't have good local food systems. So we need foods that travel far, sit on shelves, especially we have millions of people who live in food deserts that don't have readily accessible fruits and vegetables. And so they're very reliant on these ultra-processed foods. And so when you have all of that together, you do that over decades, you build a food system that is not set up for the health of the people. It's set up for the profitability of industries, whether that's the agricultural industry or it's the food industry. And what you do is you set the most people up to fail, which is exactly what our food system does.
Now, I'm really interested, from your nutrition background, what is it about ultra-processed foods that makes them not optimal for our health?
Yeah, so this is a big question because ultra-processed food, let's just define it for a second because I think that's important. Mm-hmm. So right now, the FDA is working on a new definition of ultra-processed foods. We don't have that yet. I think that's a good thing that they're doing. I think it's good to redefine it because currently, the way that we've always defined it since the NOVA classification came out, which is how we've defined it in nutrition science, is basically a food that has an ingredient or a processing method that you don't have access to. So, the best way to explain it is with corn. So, unprocessed would be corn picked from the garden. Minimally processed would be, let's say, frozen corn, where there's just a bit of processing, and that's like freezing it, shucking it and freezing it. And then processed would be maybe canned corn with some salt added to it. And then ultra processed would be a Dorito chip, right? Because you can't make a Dorito chip in your kitchen.
Yeah.
But within that definition, there's a ton of variability in terms of nutrition. So there are some ultra-processed foods that are very nutrient dense and likely not a negative thing on people's health. And there was some great research being done at the NIH about this. Well, protein powders, for example, are ultra-processed. You can't replicate that. You can't make that in your kitchen. There's some yogurts that are ultra-processed because they have an ingredient that maybe you don't have access to. And there's meals that are these meal kits that are really nutrient dense. They have a lot of fiber. They have a lot of nutrition in them, but they would be considered ultra-processed by this basic definition that we have, which is a nutrient or processing method that you don't have access to. And so that's why there's never really been kind of an idea that or a recommendation that's come out that says cut all ultra-processed foods because of that variability. And so when we think about that's why I always term it low nutrient ultra-processed foods, because I think that that's a better definition, but I do think we need a better definition of what it means when we're trying to tell people to avoid those particular foods that are, shelf stable, don't have a lot of nutrition, don't have a lot of fiber, because a lot of these they strip the fiber out and they strip kind of the satiety features out of the food, and so you're bound to eat more of them.
Now, so one thing I've heard about ultra-processed foods is the stripping away of nutrition. So basically, as the more and more processed they get, the less kind of nutrient value they have. And then there's been so much that has been made about things that are then put in the food, chemicals and other things. And so when you pull that apart, is it both things working simultaneously? Why would that product then cause cancer or obesity or something else or diabetes?
Well, a single product isn't causing those things. So it's you have to look at dietary eating patterns. So if someone's dietary eating pattern are predominantly these foods that are low in nutrients, high in calories, and it causes them to overeat. If they're over consuming, that would be something that could lead to down the road, obesity or cardiometabolic disease like type 2 diabetes. But it wouldn't be that single product that they just consume that's causing that. There was some good research. We don't have a great answer for your question. There was some good research being done at the NIH about this. Kevin Hall's lab was looking into ultra-processed foods and what was actually the driver of overeating, because we know that people, when you get these ultra-processed foods that are shelf-stable, where the fiber is kind of stripped out, they're overeating them. And so what's actually leading to that overeating? Is it the combination of salt, sugar, and fat, which we have some good data on? Is it some of these additives that help kind of emulsify it? And so, it makes it easier to eat. And we just don't have great data on what specifically it is. The best data that we have shows that it's these nutrients like really high sodium, really high fat, high sugar, those types of things kind of are high satiety things that lead you to overeat.
One of the ideas that we're talking about with Michael Moss is, the idea that ultra processed food is as bad as cigarettes, and namely one from an addiction standpoint, but then also, health implications. I think for the general population, it is now widely understood that there's this link between cigarettes and lung cancer and some of the effects with that. Would you agree with this statement that they're just as bad and they should have warning labels and things like that?
Again, we don't have a good definition of ultra-processed food and what specifically it is that's driving. So cigarettes, we do. I mean, cigarettes are pretty standard and we know what's driving health outcomes. With ultra-processed foods, there is so much variability within that definition, because what our definition says right now is an ultra-processed food is an ingredient or processing method that we don't have access to. Right. And so we would have to have a better definition, which again, the FDA is working on. And so I think it's really difficult to just blanketly say ultra processed foods are as bad as cigarettes. There's likely variations within that definition where there's better for you ultra processed foods, and then there's not as good for you as ultra processed foods. And so whether or not it's the ultra processing that is the issue, or it's the stripping of nutrients and the stripping of fiber, and the high satiety or the low satiety factor of those foods, versus it just being under this definition that we term ultra processed right now, is yet to be determined. Are
there certain? Well, you mentioned that if you get more specific, are there certain groups of things that would fall under ultra processed foods that you would have more concern about than others?
Yeah, of course. Anything that's really, you're stripping out the fiber, you're stripping out the nutrition. So it's really high in calories, it's really high in fats or sugar or sodium. I think those are definitely, in terms of dietary eating patterns, those are going to be negative on health impacts. And that's why I say, one of the things we would do if we were working one-on-one is kind of reduce your intake of low nutrient ultra processed foods.
So if someone just reduced the nutrients that was in a particular product that you're consuming, would that make that product neutral in a sense? It's not providing any benefit to you, but it's not necessarily providing any harm to you.
What kind of food is it? Let's just
say you take something off the shelf, and I don't know, if you take an apple, for example, right? In its pure form as a whole food, there's nutrient value. Mm-hmm. Now, if you then are consuming an ultra processed food that's in a package and there's a long shelf life, they strip out all the properties of whatever that whole food was, and it just doesn't have any nutrients. Does that mean when you're putting that in your body, is that a neutral thing, or is that automatically a bad thing? I guess I'm trying to get at the idea of, we've internalized the adding of these chemicals, and the adding of the chemicals is the thing that's, and there's been so much made in the Maha movement of that and the dyes and everything else. Mm-hmm. And so I'm trying to help people get clear on what it is about that's being added in that there should be concern about that's warranted.
Yeah, I mean, the best evidence that we have right now is just looking at the nutrient profile of a food. So is it a food that has a lot of fiber and a lot of vitamins and minerals, and is pretty low in sodium and pretty low in, sugar? then it's probably a decent choice for someone. Is it like a yogurt that's lower in sugar, and then it's probably a decent choice. An apple is obviously always a great choice. Whole foods are always safe, for most people. That's a general recommendation. Obviously, there's some people who have their own issues, but so the idea is when we look at a dietary eating pattern, you want the majority of your food coming from whole foods, right? So, and this this is individual advice. The majority of your diet should be coming from whole foods, and then you can have, some crackers every once in a while, like those types of things. They're not going to be like detrimental. So it's really difficult to say like single foods, because from a nutrition perspective, you always want to look at the overall dietary intake. So somebody's like overall diet. Right now, in the United States, most Americans are eating the majority of their diet as these ultra-processed foods, and the majority of that is low-nutrient ultra-processed foods. Something like a soda, which is just straight sugar, no nutrition in it. So we're drinking a lot of soda. Those are poor health choices if the majority of your diet is coming from those types of foods. Whereas what we want to do is see more people eating, nutrient-dense whole foods, fewer low nutrient ultra processed foods. It's just our food environment right now is about 70% of these ultra processed foods. And so we're really building a food environment in direct opposition to what we're kind of recommending people consume.
Now, when it comes to the additives, what is, the truth or your concern there, of the things that are being added into foods to preserve them? And, the idea of something sitting on a shelf for like 2 years, for example, what is your take on the additives?
Yeah, my take is that this is a hallmark of the MAHA movement, and it's one of the things that does really well on social media, is kind of like fear-mongering individual additives without a good amount of evidence on those individual additives. So, additives, things are added to like preserve food. I mean, salt is a preservative, right? It preserves food. So we have these like chemicals, but I want to be clear, like everything is a chemical, right? Like an apple is also made out of chemicals. So these are these chemicals that are added to foods to preserve them or to emulsify things, because, if you just have like a fat added to something else, it won't emulsify well. So you add an emulsifier and it emulsifies it. Again, this work was being done to try to see, is it these additives that's a problem? Are they impacting people's health, or is it mostly the nutrition that's driving it? So is it mostly like the salt, sugar, and fat? And what we know to be true at this time is it's mostly those nutrition factors versus the additives. Now, is it a problem because, again, we are over-consuming these low-nutrient ultra-processed foods that have a lot of these additives? Potentially. And we should do that research to see. But I'm far more concerned about the dietary pattern that is getting all of those additives because they're over-consuming low-nutrient ultra-processed foods, so they're not getting the nutrition that they need, than I am about the actual additives. So that's where kind of like focusing on the wrong problem can come up with wrong solutions. And so if you're thinking that it's all the additives, and so you're like, well, it's this additive, so I'm just going to swap out that additive in Skittles and then pretend it's healthier Skittles, that's not going to help anything, because it's not that additive in Skittles that makes Skittles unhealthy. Right? It's the sugar in Skittles and the lack of nutrition in Skittles that makes Skittles unhealthy. And so just swapping out that additive is not going to change anything. And so that's why it's really important to understand like the entire dietary pattern and not just focus on something that we don't have good evidence to show that is actually the main driver of health, where we do have really good evidence to show that these nutritional factors are the main drivers of health.
I think one of the arguments that I have found compelling about the additives is, when it comes to like grass, we're like generally recognized as safe, right? So there's all these things and additives that have been put into food over the past 50, 60 years, that stuff that, from my understanding, I don't know if this is true, was not previously being used, obviously, and they don't exist in whole foods. And so I think the compelling part of it is like, if it's uncertain and we don't know, to me, it's like, well, why would I want to put that in my body? Why would I not just like want to avoid that completely? And that doesn't mean like one additive. It means like a whole list of things that are commonly being used.
Yeah.
Like, it seems like a bad bet to be made if we don't really know And so we don't want to put too much focus on it, but maybe in 30 years we'll know. And then retroactively we're like, oh, that was bad for us. And like, maybe we shouldn't have had these things. And so just the general avoidance of the additives seems like a wise thing to do. What is your take on that?
Yeah, I think that's a precautionary approach, and I think it's completely fair. You can take a precautionary approach to a lot of things because we have not had great nutrition science funding. And for the whole GRASS program, I'm a big advocate of closing the GRASS loophole. One of the things you have to do in order to close the GRASS loophole is adequately fund the FDA and not cut FDA funding and not cut a bunch of people at the FDA. You can't do that simultaneously. You can't close the GRASS loophole and then make all these cuts to the FDA food division, which is what we've seen happening. And so I think that it's very fair to take a precautionary approach. I think where the issue is overstating what we know to be true. So calling things toxic when there's no evidence that they're toxic, and calling things poison when there's no evidence that they're poison, or that they're even the main driver of health, which is pretty much in the opposition of what we know to be true in the evidence. So it's completely fair for someone to say, I'm just going to take a precautionary approach and kind of avoid these things. And, again, the recommendation would be to avoid as many low nutrient ultra processed foods as possible. Right now, that recommendation is coming from the idea that they're pretty low nutrition, right? We want you to get more nutrient dense foods because that's the dietary eating style that we know to be the most healthful. The issue comes in when we're overstating it and saying things that just aren't true or known to be true in the evidence.
I think part of it is like the breakdown in public trust around companies and institutions, in the sense that, I mean, again, this was my understanding when I read it. It might be incorrect, but when you look into GRASS and the way that actually is kind of regulated, mm-hmm. It's leaving the company's agency to kind of self-report if they basically are adding things into food. Yeah. And so they could start creating new things, creating new additives, and just throwing it in. And if you had a system where it's like, oh, these are highly ethical companies and they have public health in mind, okay, we can trust them to like not be throwing things into food that they have a general idea that, oh, this could be harmful. We don't have amazing evidence for it, but it could be harmful. Oh, we'll just throw it in anyway. I think like there's been a breakdown in public trust, and Michael Moss famously wrote in Salt, Sugar, Fat, the way that book opened was like a 1999 meeting in Minneapolis between all these heads of and CEOs of food companies, where they were presented the evidence of the adverse health effects that were happening from their products, mm-hmm. and yet they walked away from that meeting of like, well, whatever, let's just continue doing what we're doing.
Yeah.
And so I think the public trust thing is just completely broken down. And you said earlier that it's not like they're intentionally trying to make you sick. I think it's like we're not making these products so you get cancer.
We just don't care if you do. Right? It's like not necessarily they don't care.
I mean, that's kind of like, yeah.
Kind of like that's not their primary goal, their value. Their primary value is profit. So
I mean, is that essentially the same thing though? If someone's like, no. I'm making a product and I know that this is increasing cancer rates versus like, I'm intentionally trying to do it, it feels like, I don't know. It seems
I think it is different. I think it's an important distinction because I think you have to understand why it's happening, and it's happening because of the economic system that we have, which, there's pros and cons, and we should be honest about that. And one of the cons of our economic system is the fact that the profit prioritization comes above all other values, and that's why we have for decades underfunded public health programs. It's why we don't have, we don't have a value system where health is equal to profitability. And we're seeing the consequences of that system in our health outcomes. And when you compare them to other countries who have a more value-based system, they still run capitalist economies, but they have regulation and they have value-based kind of programs in place, and you see better health outcomes. So I think it is an important distinction to go from kind of the conspiratorial side where they're intentionally making us sick to, no, this is just the logical conclusion of the economic system that we've built. So I think that's really important to kind of understand that differentiation.
One of the things that I've been interested in recently is like, so there's been a lot of these emerging food companies where I guess they're still creating ultra processed food. And I wanted to get your take on this, where there's like 5 ingredients that is in the list of these packaged foods, and they're all organic. I mean, if you go to Irwan in Southern California or LA, I mean, you'll be faced with all these products. Do you think that's a solution that would meet in the middle between convenience and ethically sourced things and things that still have a nutrient value, or do you think that still is kind of problematic?
No, I mean, that's kind of what I was talking about when I said there's variability within ultra processed foods, right? So in those situations where those are like meals, and I think RFK Jr. actually he promoted one of these companies that do these meals kits essentially. And they're like these meals that have a lot of nutrition in them. They have a lot of fiber. They still meet the definition currently of ultra processed foods. But that doesn't mean that they are harmful, like something like, I don't want to name a company, but some sort of like chip that is high sugar, high fat, low nutrition. And so those are two very different things that are going to have a different impact on someone's health if eaten over time. And so that's, again, why it's so difficult when it's like, oh, should we just avoid all ultra processed foods? And it's like, well, there's a lot of variability there. So maybe it's okay to actually like consume fairly often and others not so much.
Now, when it comes to nutrition science, I find this to be another interesting area because of how often people say that it's so hard to make sense of and track. And it's like, how do you track this one ingredient in your body versus the 10,000 other things that are going on in your body? So Marion Nessel has written extensively for decades about how food companies often fund their own studies and kind of studies designed to blur the line between, evidence and marketing. And so how would you help people understand how food studies are actually conducted and what goes on behind the scenes there?
Yeah, so I think it's important to understand the difference. So food companies, and just like supplement companies, sometimes they fund their own studies to show like there's a benefit of their particular product. Mm-hmm. That's pretty we call it marketing research. So a lot of times these companies will do marketing research. It's when you're very much trained to identify kind of like funding source and what the question actually was, and was the question set up in a way that it's a good research question, and does it match the study design? And so all of that kind of goes into assessing a research study like that. Just because there is a funding mechanism that's there doesn't necessarily mean that the entire research study wasn't well done. So you have to you look at it and you definitely take that into consideration, and then you look at, well, was it a leading way to kind of create the study? But the vast majority of nutrition science research is done by the government. So we do it through the NIH, these big trials that actually have a really big impact on what we know to be true from a nutrition science perspective. What kind of dietary eating patterns are healthful? Those types of big questions. What kind of dietary eating patterns can reduce risk of cardiometabolic disease? So a lot of that is done at the NIH through government-funded research, which is very different than the marketing research of a single company. And so when we're looking at kind of the guidelines for nutrition recommendations, we look at global nutrition science research, and a lot of this global nutrition science, because nutrition science is done all around the world, not just in the United States of America, and we have access to all of that. And so you look at kind of what are these big trials saying in terms of outcome data, in terms of the best eating patterns for health. And so that's where we kind of get those recommendations, not necessarily from the marketing research that comes out of single studies. So it's really important in science to not just look at single studies and individual studies. You take one of those studies and you put it within the context of all of the studies. So maybe a study comes out saying this thing, but 99 of other studies say the exact opposite. That means that if you just show this study, that's what we term cherry picking the data, right? Because you have to look at it in the context of what everything says in nutrition science research.
Yeah, I think where people potentially might feel powerless is if you're just an average person and you're on your phone, and all of a sudden you just see an article study finds that Coca-Cola isn't bad for you, right?
Yeah.
They're not knowing how to do everything that you were just describing about how you would sort through the data and whatever else supports that.
Yeah.
And so I think the relevance there would be I think when I read Food Politics, this was a long time ago, but most of the studies done by food companies on their own products or related to products produced like a favorable outcome. And so, I mean, even if it was like had to do with dairy or something else, like there was always like, so why is it that there would always be a favorable outcome from someone like conducting their own study?
Probably because that if they don't get a favorable outcome, they don't publish the data, which I think, they probably should be publishing that data as well.
Yeah. When you zoom out.
Can I just say one other thing though about what you were saying about how, Coca-Cola funds a study and it comes out that like exercise is more important than nutrition, whatever it is that they're doing. I think it's important to understand that media sensationalizes findings of single studies. And so this is why people think nutrition science is so confusing. It's not necessarily because the nutrition science data that we've had is confusing. Like that's been the big kind of pillars of nutrition science have stayed fairly consistent over decades. It's not fun. It's not flashy. It's like eat more fiber, eat more whole foods, eat more fruits and vegetables, those types of things, eat more whole grains. That's been pretty consistent over decades. What is tricky is that, a new study will come out and then the media will kind of sensationalize that study and then social media will promote that. And it's a single study of like whatever it says. And if it says something that's new and unique, like that will get kind of promoted, but we don't like make clinical guidelines based off of single studies like that. So that would go into the overall like pile of nutrition science research. And then we would kind of assess everything, but that's not how it is portrayed in the media. And so I think that's where a lot of the confusion comes into play in terms of like nutrition in general, is that, it's not necessarily a representative of what scientists are actually finding when they're doing this work.
Now, is ultra processed food just one piece of, we're talking about chronic disease epidemic. Is that just one piece of the equation? And if so, like what would the other piece of the equation be that can kind of contribute to the whole story of why these diseases seem to be skyrocketing?
Yeah, so in the United States, 90% of Americans, over 90% of Americans aren't meeting vegetable guidelines and aren't meeting fiber guidelines. So we're not eating enough vegetables, we're not eating enough fiber. Over 50% of us are eating too much added sugar. And some of us, a big chunk of us, are eating way more added sugar than what is recommended from evidence-based recommendations. 70% of us, and this is the biggest one, are eating too many calories for our needs. Right. And so we're over consuming calories for what our bodies need. And so when you look at kind of dietary patterns in the United States, we are overwhelmingly not meeting evidence-based recommendations for nutrition, for dietary patterns. And so it's actually not that complicated. Like when you look at that, it's very easy to say, we don't really need to look that much further. Like we're not meeting recommendations. And if we were meeting recommendations, we would be far better off. So what you have to do is you have to ask, why aren't we meeting recommendations? Why are over 90% of Americans not meeting dietary recommendations? And this is where my work went, because I was focused on the individual at first, kind of looking at how can I reduce risk of type 2 diabetes and cardiovascular disease from an individual perspective. And when you get into the research, you see that we have very good data on the dietary eating patterns people should be consuming, but no one's consuming them, and I say no one kind of hyperbolically, but very few people are consuming those dietary patterns. So you have to ask why. Why in the United States are we not? And then it becomes impossible to not look at our food system and the system that we've created, because we've created a system that is, again, setting people up for failure, right? We have a food environment that is dominated by these low nutrient ultra processed foods. We have an environment where we don't have, millions of Americans don't have easy accessibility to fruits and vegetables. And when this happens over decades, it becomes part of our culture. And so now, because of a lot of policy-based things in terms of changing our food environment, this is now the culture here, and it's the culture to have these commercials with these mascots kind of, I grew up in the 90s and I remember all these mascots just like promoting these like high sugar, bright colored, like ultra processed foods. Right. And we were like, oh, that's so fun. And then they're like at the kids' eye level when they go into the grocery store. And then of course they want them all. And so it takes a lot to overcome culture, but policy can help drive some of that change. And so, starting regulating things like marketing, starting to decrease the price of some of these like fresh fruits and vegetables, bringing back local food systems. I tell this a lot, but my husband's from Romania. And so he came here in his 20s. And so we go back most summers. And I'll just walk down the street with my mother-in-law, and there's this like amazing market of fresh fruits and vegetables, just like right down the street from like local farms that bring it in. It's cheap. It's like so much cheaper than going to the grocery store to buy fruits and vegetables. And they're fresh. They were just locally picked. We do not have that here in the United States, right? We have farmers markets, but they're like 3 times the price, and it's like boutique and luxury. And so, all of those things play into the idea that Americans just overwhelmingly aren't meeting nutrition guidelines. And so, that's not fancy and it's not fun to talk about. It doesn't do well on social media like a lot of conspiratorial things do. And so I think that that's really the biggest issue. We're so focused on these, like, if I make a list of 10 things that are really contributing to the negative health outcomes in the United States, food additives would be kind of on the bottom of that list. There's so many other things to look at, and yet we spend so much of our time kind of on these trivial things that we don't have any data would actually move the needle on health.
Now, let's just say the general population was meeting their nutrition intake.
Yeah.
The other piece of this equation that with health that has gotten way more publicity in the past 5 years is exercise, sleep, chronic stress, intersection between chronic stress and your gut microbiome and all that stuff. Would having proper nutrition intake just solve the problem, or like you have to look at all of these other things as well?
You have to look at all the other things as well. And they're all kind of interrelated. But yeah, I always talk about it in terms of like these 4 pillars, which is funny because you just kind of mentioned them. But in terms of the main drivers of chronic disease, right? You have to look at your nutrition, your exercise, your sleep, and your stress, and then your healthcare access. Yeah. So I kind of put stress and sleep together. And so then you have to look at, okay, well, why is nobody meeting these recommendations? So again, over 90% of Americans aren't meeting dietary guidelines. Over 80% of Americans aren't meeting baseline physical activity guidelines. That's 150 minutes a week. So 30 minutes a day, 5 days a week of moderate physical activity, and then, lifting a couple times a week. And 80% of Americans aren't meeting those basic guidelines. The average American only walks 3,000 to 4,000 steps a day. I mean, we're in New York City, so the average person here actually walks quite a bit more. But if you look at America as a whole, we're not even moving. And we have a built environment where millions of Americans don't have access to safe sidewalks or parks, or our cities and towns aren't walkable and bikeable. We have terrible public transportation systems in this country. All of those types of things from a public health perspective are things we could do to improve kind of physical activity levels. And then you have, stress and sleep. We're overstressed. We're underslept. Most Americans are not meeting sleep guidelines. And we live in a very stressful environment where people are dealing with that. So all of those things really play into this kind of like what they term epidemic of lifestyle related chronic disease. And it's not because the science isn't there to tell us what we should be doing. It's because no one's meeting the evidence-based recommendations of what we should be doing.
Mm. Yeah, I mean, the last piece I added on, the healthcare, I want to tease that out a little bit, because there's been a tremendous amount of skepticism that has been drummed up towards the medical system now over the past few years. It's not just the food companies. And people have heard the statements like doctors are paid to keep you sick, stuff like that. Or at least similar to what you talked about with the food companies, there's an incentives problem. So there's not like an incentive to like basically like help you get well.
Yeah.
And so in your opinion, like, is that an accurate depiction of reality?
Well, we have a for-profit healthcare system in this country, which is very different than most other high-income countries. All other high-income countries have some form of a universal healthcare system, and our healthcare system is not like that. We have a very fragmented system where pharmaceutical industries are making a lot of money, insurance companies are making a lot of money, Hospital systems are making a lot of money. We talked in the beginning of this conversation about how we spend more than twice as much in healthcare costs than the vast majority, than the average of other OECD countries. That's not just because we're sicker. That's also because these industries are making an incredible amount of money off of us. Whereas, in other countries, it's not like that. There aren't industries making billions and billions of dollars in profit every single year. And so the healthcare system is designed in the same way that the food industry is designed, where it's to maximize profits for these different industries. And so where there's this big misconception, I think, is this idea that it's the medical doctor's fault, where the medical doctors are operating within a system that they basically have to adhere to insurance companies and what insurance companies say. So they literally have 10 to 15 minutes with you, right, in an appointment. They would love to have more time. They would love to have more touch points, but they can't within this for-profit medical system that we have. So I think one of the best ideas would be to expand access to primary care and change the incentive structure so that people had more touch points, they had more time with their primary care physician, and we know that could help improve outcomes if more people had accessibility to that. But the entire system, the way that it's designed, is designed to keep a lot of people out too. So in the United States, unlike every other high-income country in the world, we have millions and millions of people who don't even have access to healthcare, and millions more who have healthcare, they have some sort of health insurance, but their deductible is so high that they don't actually go to the doctor because they're going to have to pay out of pocket, right? If you're paying, like, let's say you're paying $200 a month in premiums and your deductible is $5,000, you're not going to go to your doctor's appointments. You're going to wait until you're sicker and sicker, until you have to go, until it's an emergency. And then that, first of all, that's going to be far more costly when you do that. But also we're going to see worse health outcomes because people aren't getting screenings and they're not going for these preventive visits.
Yeah, we talked offline about this a little bit, but we had Casey Means on the podcast last year, and this was before she was part of like the MAHA movement. It's funny because in the episode, it was the summer of 2024. I was just talking about politics and how this stuff doesn't get talked about, and now she's going to be like the U.S. Surgeon General, which is just wild because I just was not expecting that when I was speaking to her. But one of the things that she had brought awareness to with this whole string of media appearances that she made last year, she was talking about this idea of RVUs with doctors and like relative value units, and that the more RVUs that doctors bill, meaning the more patients they see, the more procedures they perform, the more likely they are to get promoted, and the higher their salary becomes. I'm not sure how familiar you are with this whole aspect of the equation. Do you think that is overstated, or it's not like a complete or it is an accurate depiction of that reality?
Yeah, I'm not a medical doctor, so I would defer to medical doctors working in the system to discuss that. I would just say that medical doctors are very much constrained by a for-profit medical system. And so a lot of them, because I know a lot of them, want to have more time with their patients, be able to do more for their patients, use their extremely valuable expertise, particularly in primary care with their patients, but they're not able to spend the time that they want because of the system that we've built.
Yeah, I mean, anybody who has been to the doctor, it is this kind of thing where, you spend 15 minutes with them, and it seems like at best. Yeah, at best. And it seems like there's a simple solution in a lot of regards that is just kind of thrown at you, whether that's, and this has happened literally to me, I don't need like big studies about that. Every time I go to the doctor, at least if it's like a conventional doctor, it's 15 minutes, and then it's usually like, okay, here's some pills, like take these pills. There is sort of like a symptom masking of whatever the problem is that is going on. And so it seems like from that regard, it's not really a conspiracy that it works that way, that these Band-Aids are being thrown on actual health issues.
I mean, I don't think it's a conspiracy at all. I just think we have to understand why it's happening. It's not because, traditional doctors are out to not help people get healthy. It's that traditional doctors don't have any time with their patients. I'm a dietitian, right? If we went to do a nutrition consult, that takes a lot of time. our current medical system isn't even utilizing dietitians like they could be. Like a lot of time you have to have a specific reason to kind of outsource to a dietitian or refer to a dietitian, right? You have to be diagnosed with something like type 2 diabetes in order to refer to a dietitian. If somebody comes in and just wants to improve their health, they can't get a referral for a dietitian, so it's not covered by insurance. And so they're not utilized in our healthcare system. So our current healthcare system isn't putting enough resources. I mean, we have the people that could be working in this field who could be helping these people, but our current system, because of the way that it's built, which is a for-profit healthcare system, doesn't incentivize this stuff. And so I think that the really important differentiation here is that we have to understand why we have the system that we have with healthcare and why it operates in this way. And it's not this it's a very simple reason. It's because we've built a very for-profit healthcare system, and you want efficiency in a for-profit healthcare system, right? And so if it's less efficient, it's less profitable. And so insurance companies, whatever it is, they want you to have as little time with patients as possible, and they want you to kind of see as many patients as possible. And that's because it's more profitable for insurance companies. And so, if we want to change that system, we need a better healthcare system that's not enriching pharmaceutical companies and, insurance companies and hospital systems, and allows doctors to have more time with their patients.
One of the more absurd things that happened to my wife last year was she was having these neck issues. So she went to the gym, pulled her neck, and then was just it was just not going away. And so she had to do I think she was doing physical therapy, and it was at Mount Fiore Einstein here in New York City anyway. But we were getting these bills, and then you looked at the itemized thing, and every single time that she was going in, they were charging $60 to put an ice pack on her neck. Yeah. And I was just who's setting the price for those things? I think that's where a lot of the skepticism goes, where you go to a specialist, and it's one specialist says this scan or X-ray or whatever, it costs $500. Then you go to another one, they're $200. Mm-hmm. And so it's these it's like if you walk into a store and there's no prices on things. Yeah. And so we didn't even know that. So she had a series of 6 to 8 visits, and then all of a sudden it was $360 to put an ice pack on her neck, and then they just walk away. Mm-hmm. Which the ice pack probably costs $7. And so when it comes to the setting of prices in our medical system, that's been another piece. What would you say about that and how it works?
I mean, I can't even explain how it works, and I've tried to learn how it works several times. People within the healthcare industry can't even explain how it works. So I mean, that we should all be skeptical about that. I would be the first person to be skeptical about that. I'm a huge advocate of healthcare reform and changing the entire structure, because it's so convoluted that this type of stuff does happen. My dad had leukemia and was at the hospital, and we used to joke. I mean, it's not a funny joke, but the doctor just coming in to wave would be $2,000 on the bill, right? And so, I mean, I don't think it was that was real, but that it was exactly what you're saying, right? There's just where do these costs come from? And again, it's designed like that to be so doesn't allow us to understand how anything works. And I've gone through this personally, right? I need to get some sort of procedure done, and I want to know how much it costs, but there's nobody can tell me how much it costs until it's actually finished. And that doesn't make any sense. And so, we should absolutely be pushing for reform in our healthcare system. Where I think the issue is putting all of that blame on the actual medical professionals trying to work within the system, which is what's happening now, which is intentional to erode trust in medical professionals and experts within the healthcare system. They are operating within a system that is controlled by industry and by the idea that all of these different industries need to be maximizing profit. They're the ones trying to help within a healthcare system that's set up for profitability at the expense of health.
Now, what would you say to someone who pushes back and says, well, industry is made up of people? So there's individuals at some level, there are individuals making decisions about these things.
Yeah. So are they making decisions for the corporations, or are they working within the system to help patients? Because I think that's the biggest difference. Because if you're making decisions for corporations, then you're trying to maximize profit for that corporation. If you're the CEO of a healthcare industry, your goal is to, report growth to Wall Street every 90 days. And so that's going to be your goal.
Yeah, one of the pieces in terms of the design of the system that also felt really weird to me is, so in medical school, the idea that doctors spend at least 5 times more hours learning about pharmaceuticals than they do about like exercise or nutrition. And then kind of sort of through a variety of ways, like big pharma trying to influence like what actually is being taught in medical schools. How would you frame that reality and what's actually going on there?
I mean, I think we have to look at like which doctors are we talking about. So, I mean, not all medical specialties are the same. So if you have somebody like a cardiothoracic surgeon, I don't think they really need to spend a lot of time learning about nutrition and wellness, right? They're conducting surgeries on your heart. I want them to be really, really good at conducting surgery on my heart if I have a heart attack and I need a stent placed or something like that. I think if we're talking about primary care, they spend more time on prevention and they do a lot more in terms of talking about prevention. So I don't think we can just lump all medical doctors in together, because our medical system needs a lot of this treatment care, because there's a lot of conditions that happen where they need to go and have some sort of surgery or have some sort of treatment. I also think that there's healthcare teams. We look to medical doctors to be this like panacea of everything that can help in terms of the improvement of people's health. But there are specific professions that literally their entire job is prevention and working with people to prevent chronic disease or to recover or kind of like combat chronic disease. So for example, there's registered dietitians who are underutilized in our current healthcare system. There's physical therapists that are underutilized in our healthcare system. There's so many of these different kind of like, we term them healthcare teams, that could be brought in under our system, but we could incentivize, them to be used more and utilized more. And I think that could be very helpful. I don't think we should look to a medical doctor who is, a surgeon or something like that to be somebody preventing chronic disease. I think we have a lot of professions that already work kind of on the forefront of prevention of chronic disease that we should just utilize more.
Yeah, so I mean, so you have the ultra processed food, you have the medical system, and then the last piece that I wanted to cover in terms of these sort of large systemic forces is the insurance companies itself. And so, even when someone wants to get well, like you're kind of like hit with this wall of like approvals, denials, like loopholes. Like I've literally found myself on the phone for like 2 hours with these companies, and like you get passed off, and then it's almost like you wonder, I'm like, is this just like, it's just not efficient at all, or are they actually trying to make you hang up? So you stop badgering about this. So, a lot of people are furious about that aspect of the equation, and sadly it culminated last year with, the Brian Thompson murder, the CEO of United Healthcare. Yeah. What do you see like in that moment in the pulse of the outrage, and what does it say about the anger and hopelessness that people have towards the system?
Yeah, I think it shows that a lot of us have been really hurt by the system, left behind by the system. I think that obviously so just to kind of lay it all out there, I'm a huge advocate of universal healthcare. So I have been advocating that for a long time. There's a lot of good evidence behind the importance of universal healthcare, which is this idea that it will decrease costs and it will improve health outcomes. There's data to show that it'll drastically decrease costs and improve health outcomes on the back end if we can get to some sort of universal system. You can have some private insurance on top of that if you're, wealthier, you want to buy into that. But getting universal healthcare can reduce a lot of these issues, because right now in the United States, again, we've built a healthcare system for profits. We've seen insurance company profits skyrocket, and that's at the expense of people's health, because insurance companies' profits increase when they're able to decrease costs or decrease costs for themselves and increase costs for us. right? And so I think we are all very frustrated by this system, and we have to understand kind of the root of the problem in order to then put our energy all together towards the solutions. And so, when you misdiagnose the problem, your solutions are not going to actually address the problem. And so if we think that the problem with our healthcare system is medical doctors, and if they just go have a class of nutrition one more class of nutrition in medical school, that's not going to help fix this system. The entire system is broken. It's not just that medical doctors aren't educating enough about nutrition in the 10-minute appointment that they have with you. There's just not enough time. I kind of went to bring this up, but I don't think I ever mentioned it. In a nutrition consult, that takes time. It takes 30, 60 minutes to sit there with you, kind of go through a dietary history, and then get a good understanding of kind of like what you're eating, and then make some sort of plan. Medical doctors just don't have that kind of time. So if you give them more education in that space, but you don't give them any kind of time because they're working under the constraints of the insurance company, that's just not going to fix the problem. The problem stems from the entire way that our system is built. And so that's what we need to actually focus on and see change, or where we need to see change.
Do you feel like, there's also been criticism, on the front of time with doctors, right? So if you go to a functional doctor, if you go to someone that's not taking insurance, you're going to be charged $300, $500 an hour. I've also spoken about this with psychology as well. Do you think there's an ethical thing there as well in terms of how much it costs is it a difference between a doctor making like $500,000 in a year, or because it seems like a lot of people get into the profession for altruistic reasons, but then if they're set on making a certain amount, I'm not on like the inside of this, so I don't know exactly what their mindset is, but it just seems like these things are like really expensive to begin with. Because if you extrapolate that, like a 40-hour week, or even if you see 25, 30 patients and you're charging $400 or $500 an hour, that's a lot of money. Yeah,
I think you're talking about like functional medicine appointments. There's also direct primary care where you can see a medical doctor, and it's just they don't take insurance. So they have, and I think kind of like the key thing to understand is they just have more time with you. And I think that's really the biggest driver is like, if you just have more time with the patient, you're going to get like better outcomes. They're going to feel more taken care of. You're going to be able to talk about more things. I think that in terms of like the ethics of it, it's just not scalable to the entire population. So when you're thinking about population health, right, because it's so expensive. So it's really like a luxury service that like some people can afford to have, and the vast majority of people can't. So when you're trying to think of like, how can we devise a public healthcare system, it's not going to be in these high-end services. Wealthier people can go and take advantage of those high-end services. But, for the population as a whole, we really need to look at expanding primary care and just expanding access to primary care and changing the incentives for it. And just expanding access to healthcare in general versus kind of these like boutique solutions that exist.
Yeah, I'm a big fan of functional medicine for the very reason that, to me, it makes sense to try to get to the root cause of something. Why would you not want to get to the root cause and just try to address the problem? There's complexity in what people experience, but it feels like a lot of the system, the way that it's set up, it almost makes like prevention feel like impossible. Because if deductibles keep rising, and even for people who technically have like good insurance, the functional and the root cause doctors are almost always out of network. And so you look up a list of like all the people in New York City, even like most of them don't take insurance, and so then it makes you wonder, well, why is the insurance company not allowing these people to be associated, and and then sort of preventative testing, extensive sort of testing that might be able to provide greater insight on chronic disease. There seems to be a lack of things that are actually covered, and so it seems like the way it's set up is like, oh, you have a disease, all right, we'll treat you now. Okay, you could do these things, and then a lot of it's like take some pills. So what is your opinion on like the way that that entire dynamic is set up between like functional medicine and prevention versus kind of reacting to the fact that you already have a disease and let me manage your symptoms now?
Primary care is prevention in the traditional medical model, right? That, I mean, we're talking, you have to understand the difference between the types of medical doctors. I think we lump them all together. And there's certainly a lot of like areas of medicine that are specifically treatment focused, but primary care does a lot of prevention. They do, I mean, you go see a primary care doctor, they're going to talk to you, the vast majority of them. I mean, there's bad actors in every profession, but the vast majority of them will mention, diet and exercise. It's just they have to do it so fast. They don't have time with you. A functional medicine appointment, I've never been to one, but I imagine it's more than 10 minutes. And so they're going to have a lot more time with you to discuss these things. Screening is done. That's prevention. So it's not like there's no prevention done in our medical model. But again, this is a medical system that we have built that is a for-profit medical system that is looking for profitability. And so, yes, there's good outcomes, and it's certainly really good if you need some sort of like treatment and you have good insurance. Like we have the best in the world in terms of that. But it wasn't built for like long-term chronic disease prevention or chronic disease management. That's not what our healthcare system thrives in. And it's because that takes longer. It takes more touch points. It takes more time with people. And so, that's where like a dietitian could come in and meet with you for an hour. And they're much lower cost, by the way, than a medical doctor. A lot of these like healthcare people that can be in the healthcare team, they're way cheaper than medical doctors. So like utilizing them could be really beneficial. I think the beauty about functional medicine is that they have time with you. It feels like a relationship. They can get to know you. They really can fully understand like your entire health history and like and sit with you, and you feel taken care of. And I think that's a big part of it. And our system that we have in our healthcare system just doesn't allow time for that, which is the biggest problem.
It does seem like there's like maybe it's the time thing that you're saying, but it does seem like there's a curiosity and a multidimensional approach from functional medicine or integrative doctor of like, okay, this is what you're dealing with. Oh, it might be this, could be this. Let's try this. Let's try that.
Yeah.
Like I'd had gut issues for a number of years. And so, like last year I went to just a traditional gastroenterologist about this. Within like 10 minutes, they were just like, okay, take some like antacids. And it seemed like there was like not an interest. Mm-hmm. And maybe that's the 15 minutes. I don't know. But it seemed like there was not an interest in wanting to investigate this further versus when you go to a functional doctor, it's like, okay, let's think about the 6 different things that this could possibly be and try to get to the root cause. And so I think, when it comes to the traditional model, it's just that is, basically what's afforded to people of the time that they have, the 15 minutes. So I could see why poor populations would have a shorter lifespan in that sense.
Well, I mean, low-income populations don't really, millions of them don't even have access to healthcare. So if you don't have access to healthcare, like they would love to just go to a 10-minute primary care appointment, right? But they don't have healthcare. So yeah, and right now healthcare is being cut even more. And so if we're looking at population health and we want to make America healthy, that's one of the worst things that we can do is cut healthcare access to people.
Now you mentioned universal healthcare. I mean, there's one thing I think that it seems like it's worse than the United States is like, my wife and I were away for our anniversary a couple months ago, and then we met this couple that's from Canada, mm-hmm. and it seems like Canada is like even worse. It does seem like they have universal healthcare, some sort of variant of that, but then you'll wait like 6 months, and you can't even see someone, even if you have money, and it's like, I'll just pay you, like, can you come see me? It's like you can't. And so, what are the differences with like model in other models around the world that would compare to the way the United States does it? Because it doesn't seem like it's the worst thing it could possibly be in the United States.
What doesn't seem like the worst?
The way the healthcare system is set up, it feels like it could be worse if you just couldn't get access.
Well, what do we mean by worse? Because health outcomes, I mean, we have good data on health outcomes. We have the worst health outcomes here, and we pay twice as much, right, for a for-profit healthcare system. So America is really great if you're wealthy. We have good healthcare if you're wealthy. If you are, the vast majority of Americans who aren't, it's not a great system. Wait times is definitely the number one thing, and there's pros and cons of every healthcare system. And so it's not as if it's this panacea and this perfect system. We have long wait times in the United States for a lot of things. And millions of people have a forever wait time because they don't have any access to healthcare, whereas you don't have that in other countries. Other countries at least can get healthcare access. If you look at wait times in some other countries compared to ours, in terms of primary care, they're actually fairly even, and not that different. If you look at specialty services, sometimes the wait times can be higher in other countries. And so that's certainly like a consideration. And there's ways, and these are healthcare policy experts could come in and try to like work through some of this, and what the best approach would be. And there's also options where you could have, universal like basic care for like primary care, and then you have, private insurance on top of it. So there's options, but certainly the biggest issues you've been bringing up in terms of the healthcare system all stem from the fact that we have built a for-profit healthcare system, and we have several industries making billions of dollars a year, on our care.
Yeah, when you add up the numbers, like U.S. versus other countries, it's quite shocking. Living in the U.S. shortens your lifespan by 8 years. It was reported in I think in 2021 that the U.S. bottomed out at about 77 years for average life expectancy, and Japan is at like 85.
Yeah.
And so like they're like,
and Switzerland,
a third of the healthcare. 8 years is it's like a really long time, and so. How do you explain that? What are they doing differently from with us, not just medically, but culturally, that would create such a large gap in lifespan?
Yeah, a big part of it, I mentioned kind of at the top that the main drivers of health in terms of the determinants of health are these social determinants of health. These countries that we look at, we often compare, our ingredients to their ingredients in food, but we never, for whatever reason, we don't spend that same energy, which we should be spending far more energy on looking at their social programs that they have. So many of them invest in social and public health programs that are helping with in terms of helping the population health. Because again, when you look at our health and we have such negative health outcomes, that's not evenly distributed across the United States. Our wealthy people are doing quite well. And if you look, I kind of mentioned the life expectancy age gap between the highest and lowest income populations. It's our lower income populations that are really suffering and really struggling. And so, we compare ourselves to other countries all the time. We don't even have to do that. We can compare states in the United States. We can compare zip codes, within the same state, and you see huge disparities in health. And so it becomes very visible what's actually impacting that. And it's things like access to healthcare, access to education, our food environment, certainly. It's that we've built all of these different systems to maximize profit, but the consequence of that is that health tends to suffer. They have good social programs like, paid leave programs. We work more hours than any other high-income country. We're overstressed because of that. We lack sleep because of that. All of those things are negatively impacting our health. And we have this idea in the United States that it's our personal responsibility to take care of our health. And we're trying to solve structural issues with personal choice. And that's just not what we see in data, or when we look at globally what's going on, what can actually happen. And so I think that's the biggest issue, is this idea that, we can solve structural issues on a personal level, and we just can't.
Yeah, the looking at zip codes in different populations within a country is fascinating to me. I think you had said recently, in maybe it was your social media content or another podcast, but like, rich people have like an average lifespan of 90 years, and then poor people like 72 years or something like that. It was like it's a huge gap. I don't know.
Yeah, it's 15 years for men and 10 years for women between the highest and lowest income brackets.
Which is just crazy amount of variance. Why is it more for men?
I'm not sure.
That's really interesting.
Yeah, it's a good question. I don't know.
Because globally, women tend to live longer than men.
Yeah, so maybe they're more immune to some of the harmful effects of poverty. I'm not sure.
Yeah. I think one of the downsides for me of like the information, all this information becoming public, is kind of like the lack of nuance, and which is why I really love your approach, because it's like this is all fueled like sort of like outrage kind of culture, which on one hand I actually think is warranted, but it's obscured the fact that like some things are actually working. And so it's like this binary of like, oh, we should just trust the system, trust everything, and then it's just kind of like burn it all down type of mentality. What do you think gets lost, like if the conversation just like lives on those two poles?
Yeah, I mean, I think that it's kind of a goal right now of the administration to shrink the federal government and privatize a lot of this. And so I think it's really important to identify the idea that if there's so much narrative out there in terms of like eroding trust in science, eroding trust in experts and medical expertise, the reason for that is then to justify cutting all of these public health programs, which we have chronically underfunded. And really do great work. I think the problem with public health, it's a victim of its own success, because when public health is working, you don't actually think about it. So you don't think about the outbreak that never happened because public health experts were tracking that. You don't think about the food that you're eating that is safe to eat. So, we don't have a healthful food system in this country, but we have a safe one. We rank third in the entire world for the quality and safety of our food supply, which means that we can eat pretty, we don't really think about any like parasites and bacteria in our food that can cause foodborne illness. And that's all public health infrastructure. You don't think about the water that's really safe to drink. Right. And so all of that is kind of public health at play, and you don't think about it. And so it makes it really easy to kind of demonize and think that it's very wasteful and these programs are very wasteful. Even like at the NIH, a lot of the research being done, it doesn't seem like it's like immediately applicable to something. And that's because the NIH funds a lot of basic research, which then can it seems obscure, but actually what it can do is it can create this incredible medical innovation on the back end, right? So the NIH, the government funds this research that might not be directly profitable, which industry doesn't want to fund, but that doesn't mean that it's wasteful. It means that we really need it. And so I think having a better understanding of what our public health agencies do and what our research institutions do, I think is really important, because then you don't just vilify the entire thing. You say, okay, well, maybe we can make these improvements, but let's not burn it all down. And I can give a really good example with the FDA. So I think a narrative right now with the FDA, a narrative out there right now with the FDA to intentionally kind of out there to erode trust in the FDA is that, half the FDA is funded by the pharmaceutical industry, which is the same industry it's meant to regulate. And so when you say that, and that's all you put out there, it's intentionally meant to erode trust in the FDA and then say, okay, well, we just need to cut funding from the FDA and to justify cutting funding from it. But that deserves a much more nuanced explanation. The reason that the FDA takes user fees, it's not just funded. It's not like people are giving them money to then approve drug applications. It's that they charge user fees, just like every kind of regulated industry there is. And the reason we started doing that was because we chronically underfund public health institutions. And so there was this huge backlog of these drug approvals that needed to go through approval. And so in order to do that, Congress didn't allocate more money to the FDA through taxpayer funding. What they did was they said, okay, well, you guys can start charging user fees. So there's these set fees you can charge to pharmaceutical companies in order for us to hire more people to go through these reviews. And so that's where that funding comes from. So the pharma side of the FDA is partially funded through these user fees. The food division never has had a comparable funding mechanism. And so it hasn't been able to keep up and do a lot of the regulation that we would like to see. And so when you explain that, then we can actually have a genuine conversation about what's the solution. Should we keep having pharmaceutical companies pay these user fees because then they turn around and make all the money on the drugs that eventually will get kind of approved? Or should we as taxpayers fund all of that regulation? And then the pharmaceutical companies turn around and make all the money on the drugs that get approved. And then we can have an honest conversation about that. There's pros and cons to both of those. But if you just say it's being funded by the FDA, it erodes trust in the population about the FDA, which justifies cutting it. And so I think the importance is kind of having the honest conversations, which I don't see a lot happening in media right now.
It does seem, though, that like Big Food and Big Pharma are two of the biggest lobbyists on Capitol Hill right now. And then, for people that saw the documentaries Dope Sick and stuff like that around the crisis with like OxyContin and all of those things with the Sackler family, Purdue Pharma, all this stuff. I mean, you would see these things where like people that are in the FDA then end up working at the company, and then they go back to the FDA, and it's just like back and forth. And specifically with that whole crisis around OxyContin and painkiller medications, it did seem like there was great evidence for compromise in some of these areas. So it does seem like at some level that distrust is warranted, not in this kind of like binary thing that I was just talking about before, like burn it all down, but it does seem like there's a lot of areas of the government that seem to be compromised, but it doesn't seem like the whole Maha thing is like fixing that right now.
Yeah, I mean, 100%. I'm the first to like the opioid crisis. That's absolutely awful. A lot was done after that happened to enact kind of mechanisms to prevent things like that from happening. And so I think that's what we have to do. We have to look at like what could we be doing to strengthen things. So for example, mandatory disclosures. Should we have cooling off periods? Because a lot of the reason that you see like people go to the FDA and then they go to the pharmaceutical industry is because these are political appointees, right? So they come in. So in our agencies, we have the vast majority of people working there are career scientists and public health experts. So they're there throughout many, many administrations. And then you have political appointees. So when a president is elected, they get to appoint kind of their people. So like the HHS secretary is a political appointee. The head of the FDA is a political appointee. And usually these people need really strong subject matter expertise. And usually they're there for the duration of the presidency. So let's say it's 4 years or it's 8 years. And then they have to continue their career somewhere. Right. So usually where they will go continue their career is where they could make some money in their career. And that's why you kind of see that happen. And so, there's ways that, like I said, cooling off periods, mandatory disclosures. There's things where you're not allowed to be involved in an approval if you have any conflict of interest. And so you have to recuse yourself. And so those types of things I think are really important that are done. And a lot of people don't recognize that those happen. And so we can look at like, how can we strengthen those things instead of saying like, let's burn it all down. Let's cut all of the funding from the regulatory agencies that are actually there to protect us.
When it comes to the incentives, right?
Yeah.
So the pharmaceutical company, which we didn't really fully talk about this, but the pharmaceutical companies, if someone is on a medication for a extended period of time, obviously they make more money from that. So the longer that somebody's on for a medication, it's just like statins, for example. Like if someone was able to meet the dietary guidelines for nutrition that we were talking about before, and then their body gets in a healthier state, and like they don't have to take statins anymore because of the way that they changed their diet, that's lost profit. And so there's an aspect of it, like even if we did come up with solutions for these things, like that would mean less profit for big pharma, which seems to be in conflict with the incentives that they're driven by.
Yeah, but now you're getting back to industry.
Yeah.
And now you're getting back to like industry and what their incentives are. And I'm 100% with you. And I think this is the issue. We're conflating kind of science and industry a lot. And so we're saying industry problems are actually the problems of science and regulation. And so I want to be clear, like, that's what I'm defending is science and regulation. I am not defending industry and the incentive structure in industry. And I think it's really important to kind of like differentiate between the two. Certainly, I mean, pharma's out for profit. That doesn't mean that all of pharma's bad, right? Pharmaceutical companies spend, billions and billions of dollars on these drug trials, and 90% of them fail 90% of drugs that go into, stage 1 trials fail. And so, they spend a lot of money on kind of funding these trials, and most of them don't make it. And there's a lot of pharmaceuticals that are really helpful. But the industry as a whole is a for-profit industry. And so we should be more skeptical of the industry itself, certainly.
Well, where industry meets up against the government is the lobbying is trying to keep the incentives of for example, the salt, sugar, fat ratios.
Yeah.
The way that the products are actually being manufactured. If the government comes and is trying to change that in a way that would cause them to alter their products, and then they would have to figure out how can we make this just as profitable and keep up our sales. It is in their interest to do everything to keep things the same, and I think that's where people end up thinking that the government
it's
gets
in
compromised.
Whose interest?
Industry, big pharma, big food. It's in their interest to not change.
I'm super against lobbying. So the number one public health, a lot of people will be like, what is the number one thing you would do to improve public health? My answer is always change campaign finance reform.
Yeah.
Because right now we have industry lobbyists lobbying our politicians to enact policy that is good for profit and industry profit at the expense of our health. It's just that's not science. The science is not saying that we should have more salt, sugar, and fat in our food. That's industry lobbying politicians to enact laws that don't regulate any of that.
So with the funding to the FDA, what is the reasoning behind that getting cut?
I don't know what the reasoning is. The reasoning is that the administration wants to shrink the federal government. They've been very clear about that.
Do you feel like part of that has to do with sort of the narratives that we've been discussing of why would the solution be to just shrink the budget altogether?
That it's outlined. It's outlined in their goals in terms of what they're trying to do. It's why in Trump's first administration, he tried to cut the NIH every single year that he was there, which always got blocked by Congress. Next year in his fiscal year 2026 budget, he's trying to cut 40% from the NIH. The idea has been for this administration to shrink these agencies, these federal agencies, because it's bureaucratic. They view it as wasteful, and to privatize a lot of that. And so, that's likely why they're trying to cut funding. Again, this is not really this is kind of a bipartisan issue where we don't adequately fund our public health agencies. It's the reason for the user fees at the FDA. It's the reason that we have GRAS. You talked about GRAS. It's the reason we even have that GRAS loophole was because we wouldn't adequately fund the FDA to kind of review all of these additives. And so, that's kind of in a bipartisan way, we haven't adequately funded it. But certainly this particular administration is trying to shrink the federal government.
So how would you help people understand the cost of shrinking the budgets of the NIH and FDA and stuff like that?
Yeah, so right now we have programs being cut. So for example, at the CDC, we have the chronic disease programs being cut. You have a lot of scientists who have been furloughed and fired, and those are scientists who are doing things like food safety. We see food safety programs being cut, and so they're monitoring the safety of our food supply. At the FDA, if you don't have adequate funding, many of the things that the MAHA movement wants, which many of us in public health want too, which is stronger regulation of these food additives. So we want stronger oversight of the food additives. So, I'd love to see the GRAS loophole closed, but I kind of said before, you have to adequately fund the FDA so you have scientists to do all those reviews. I'd like to see stronger post-market analysis on these additives. So let's say something gets approved. It's been 10 years. Let's go through all the evidence that we've seen in the last 10 years and update our regulation, right? Is it still safe? Are there any concerns? And that post-market analysis, we don't have strong post-market analysis because we haven't adequately funded the FDA. And so if you're not adequately funding it, what you see is a system like we have now, which is corporations who are able to kind of self-affirm GRAS. You see in terms of the pharmaceutical side, you see this need to kind of charge pharmaceutical companies because we're not adequately funding it. At the NIH, we're seeing programs cut. We're seeing research in cancer and Alzheimer's and many different things cut. There's career scientists who have left the NIH. And if you aren't doing research in these areas, that basic research, all of the medical innovation we've gotten in the last 150 years has come from scientific research, right? And so you need really strong biomedical research. That's what's made us kind of a leader in the healthcare fields, in the healthcare space, and healthcare innovation has been this biomedical research. And so when that's cut, you'll see less innovation on the back end.
Now, I mentioned off the top that it's like been 14 months since those meetings, and it feels like not that much has changed. Do you feel like this is a lot of these changes? Do you feel like it comes down to? I mean, obviously, RFK is running things. Do you feel like it's a lack of knowledge? Is it a lack of not knowing what to do, or is it like people think they're going to come into the government and it's going to be like easy to do certain things? So I guess what I'm asking is like, do they just not know the proper thing to do, or there are things that they want to do and it just becomes wildly unrealistic what their ambitions are versus the reality of actually trying to accomplish those things in the government?
Do you mean the MAHA movement or the Trump administration?
I mean, isn't the MAHA movement a subsidiary of the Trump administration?
Yeah, I think I think that the MAHA movement was used by the Trump administration as a way to enact their agenda, and their agenda was very much to shrink social programs, social safety net programs like Medicaid, like SNAP, to roll back healthcare, kind of Obamacare, what they term Obamacare, but the Affordable Care Act, subsidies, those types of things, to shrink the federal government, which include our public health agencies. And I think the way that they've been able to do that, where they've gotten a lot of pushback before, has been because of this messaging, eroding trust in science and public health. And so in order to kind of enact this without a lot of pushback, this movement has been integral for that, so that they're able to kind of do it with public support, thinking that that's going to make America healthier. I think that we need to take a lot of blame in the public health sphere and the science sphere for not really helping to explain why even these agencies are important, why research is important, why, the difference between where their real frustration is, which is that these systems are failing us and we have poor health outcomes. What are the actual causes of that? It's not what it's being like kind of scripted as, which is this corruption in science. It's that we have really actually strong science-based recommendations. No one's meeting those recommendations. And that's because of kind of this for-profit system that we've built in this country.
So do you think it's a matter of potentially like RFK having certain ambitions coming into this, but that being at odds like in infighting or between people that are part of the administration of like actually trying to, because the things that you were laying out seem to be relatively straightforward. And so it's one thing if like RFK running all of it just doesn't know what to do because he's not a medical doctor, or it's like there are certain things he wants to do, but he just doesn't have the actual power to do those things.
Yeah, I mean, he's HHS secretary, so he doesn't get to dictate agricultural policy, for example, or some of those things. But he certainly has a lot of influence over our health agencies, our public health agencies. I think it's more of a function that a lot of what the MAHA movement says they want is in opposition to the policies that are actually being enacted by the Trump administration. And so that's what I try to help people to understand is that, you want fewer additives in our food supply. In order to do that, we need stronger oversight, stronger regulation of our food supply. But right now, the agency tasked with doing that is being cut even more than it already was. We already had poor funding in that agency, which is the exact reason we have the loophole that we have with generally recognized as safe designation.
Yeah.
And so helping them realize, like, if you want that, advocate for more funding for that particular area. If you want a better food system, advocate for funding to enhance local food systems. Right now, what we're seeing from a policy perspective is many grants, many small business grants, many grants that help get local food to schools and food banks in local food systems and helping those farmers farmers kind of start up businesses within those local food systems, smaller, more diverse farms, we're seeing those grants cut. So that we're not going to, a lot of those farmers, I was just at Farm Aid, which is this event for a lot of like small regenerative farmers or people doing farming in cool, innovative ways. Many of them have seen funding cut this year, and they are concerned that they won't be able to continue in this way. And so when we're looking at like what we want, like I'm with you, we want this too. Here's the policies that are actually going against what we actually want.
One of the more unfortunate things that I had heard. So we had Dr. Walter Longo on here, and he's one of the pioneers in studying fasting and the intersection between fasting and chronic disease. He came up with the whole fasting mimicking diet, but he's done some really incredible trials at the University of Southern California. A lot of them were on mice, but then it moved into human trials. But the effects of fasting and reversing chronic disease and there are certain parts of it, right? Like if you just did water fasting, there could be adverse effects on muscle. So then he created the whole fasting mimicking diet. How do you get the benefits of fasting without all of the kind of negatives? But when he wanted to expand trials to larger groups of people. But when he went to the government and tried to do this, and he put together the design for all these studies, he was really struggling to get like $15 million just to get approvals on these things. And it did. This was a couple of years ago before Trump was in administration, but it seemed like from what he was saying that like stuff with pharmaceuticals, it's easier to get pharmaceutical based intervention, like trials for that, approved than something that he was doing. And I was like, it just felt really unfortunate to me because I'm like, this is like really incredible work that he's doing around fasting and cancer and chronic disease, and the possibility of this intervention and like really solid studies and trying to expand like the research around humans. But there was like a block. I don't know if you have any.
Yeah, I mean, was he trying to get NIH funding?
Yeah.
Yeah, I mean, if you look at NIH funding, it's very low. I have lots of friends who are researchers, and they have, you have to submit 15 grants before you're approved. So it's a really, really difficult and very competitive grant funding cycle. Or grant funding mechanism. And so I don't know. I've never read his grant proposal, but I wouldn't say that like just because he wasn't getting funding, it was because he wasn't a pharmaceutical company. And the NIH doesn't actually fund drug trials. Pharmaceutical companies fund drug trials. So the NIH doesn't fund, the NIH funds basic research that can then be used in order to like create pharmaceuticals down the road. A lot of it's never used. But that's not because they're prioritizing. The NIH is certainly not prioritizing like pharmaceutical trials because they're not running those. We tried to get NIH funding for a number of studies when I was in graduate school and then as a professor, and they were denied. I'd have to look up the actual like percentage, but it's in the single digits of like for a lot of areas that actually get funded. So I would just kind of push back on that a little bit and say it's probably not because it was like a fasting protocol. It was potentially just not funded because most NIH grants aren't funded.
How much is the total budget for the NIH for the whole year?
Oh, I don't know the answer. I would have to look it up. Yeah, I'm not sure.
We spent a lot of time talking about the system. Like, what do you want to see? Like if you could have like a perfect world, what would you like to see happen from here? Because like there are a lot of these forces, there are a lot of things working against people. I mean, we'll get into the wellness piece, but like the public health piece does feel like such a kind of thing that is in people's way.
Yeah, I think it's really hard because it's a big topic, right? And it seems almost insurmountable, and so I think it like can overwhelm people to kind of think through some of these things. And it's also why like easier messaging works better. Like, oh, there's toxins in our food and that's why we're sick. That's a lot more difficult, or that's a lot easier to sell than like all of these systems have been built for profitability at the expense of our health. And so here's where we need to go. Where I would like to see is we have so much energy right now in terms, and this is a wonderful part of the MAHA movement. They've brought all of this energy to kind of people thinking through public health before. They're thinking through like, how can we improve the health of America? I'd love to see that energy directed at policy change that could actually make a big difference. So policy in terms of our food supply that could actually improve our food supply, policy that could improve our built environment so that we could make things more walkable and bikeable, taking really strong public health data that we have that can show better improvements on a population level at scale, and taking some of these programs and funding them, because funding those programs is actually very cost effective because you get better outcomes on the back end. You know, something like the Supplemental Nutrition Assistance Program, which is our nutrition assistance program in the United States, funding that, every dollar that goes into that program generates $1.50 to $1.80 in economic activity. It's an incredibly effective and efficient program. And the reason is because those people use those $7 a day on average SNAP benefits, and they directly put them right back into the economy, right? Because they go and they purchase food with that. And it's efficient, or it's effective as well, because it directly decreases food insecurity by up to 30%. And so funding programs like that is actually very good on the back end for health outcomes. And so looking at what public health data do we have, what can expand at a population level to improve health, and looking at putting our energy into those policies.
So, on the wellness standpoint, if someone's thinking about like their individual agency and how to go about improving their health, what are some sort of like simple principles that like would move the needle?
Yeah. So, you got to look at the 4 pillars that I talk about, right? So, 5 pillars, I suppose. So, meeting nutrition guidelines. So again, over 90% of us aren't meeting vegetable and fiber. Start there. Just start, the recommendation is make half your plates fruits and vegetables. Most of us don't do that. Get a variety of proteins, drink more water, eat more fiber, decrease your intake of low nutrient, ultra processed foods. On the exercise side, try to meet exercise recommendations, 30 minutes a day, 5 days a week, even just start with walking. So I'm not talking, your audience is probably like people who like to optimize things and really get the best out of what they have. You have to understand, like in the United States, when I'm saying these like percentages, this is the vast majority of people in the United States. So you maybe have like an elite version of America kind of listening to this program, but like the vast majority of us aren't even walking. So like starting there and working your way up to, 30 minutes a day, 5 days a week of moderate physical activity, lifting 2 to 3 times a week, making sure you're getting 8 to 9 hours of sleep per week, which the majority of us aren't getting, trying to decrease stress, whether that's through mindfulness or some stress reduction. Exercise can be stress reducing for some people. Shopping can be stress reducing for some people. Just find what helps you and reduce your stress, and going to your preventive screening visits. So go get screened. The worst thing that could happen is, you don't catch something early and then you go to the doctor and it's a later stage of a disease that could have been prevented. So I think all of those together, if we could get America to just adopt those things, which is not what's talked about on social media, right? We kind of, on social media, 90% of what we see is like the 5% margins that could potentially make a difference. But those like pillars of health and wellness right there, if we could just get those adopted, then we'd be far better off in terms of the health of this country.
Now, I don't know the full extent of what's influencing this, but I think New York City's lifespan is like 3 or 4 years above what the nationwide average is. I'd imagine a little bit of that probably is the fact that New York City is so walkable. And the more I looked into like this aspect of the way that cities in America has been designed versus Europe, it's not like Europe doesn't have cars, but like a lot of the European cities, like you could just walk around, and it feels like as we've kind of branched out into the suburbs in America and we got highways and we got all these different things, it's just such a different experience, like living in New York and walking around, take a bike here, like you literally don't even need a car. And so you're immediately getting steps just by living. And so I think that there's a lot of things that you're saying where it's like, if you really wrestle with what somebody would actually have to do with their life, it's like they're going to have to like make decisions about where am I going to live? What's the environment around me going to be? Like the idea of getting like fruits and vegetables as well. It's like, well, that might not be a convenient thing for them. And so they have to think about like, should I potentially cook more? Or there's other things. And so I just feel like if you settle into the default way of being in the United States, like almost all of those factors that you were just talking about are going to be like working against you. It feels like a very proactive thing that you kind of have to do to just meet some of these.
Yeah, I mean, I think it's a really important point. There's this photo that I present often when I'm doing talks, and it's essentially upstream is like all of the systems that are kind of setting people up, right? So like, does your food environment have easy access to fruits and vegetables? Do you have sidewalks to walk? And then downstream are your individual choices. Both are very important. What most of us in this country are doing are swimming upstream. And so we're swimming against this current that's like trying to hold us back. And we're having to work hard to kind of overcome a lot of the systems and structural issues in this country. And like, what would it feel like to just turn around and be able to swim with the current, where your systems and your structures are set up for you to succeed, and you're able to make individual choices that help you to succeed. What we have done, and from a population health level, what you need to look at is, we're setting systems up for the majority of people to fail, where we want to set systems up for the majority of people to succeed, where there's fewer barriers to success. You're still going to have people who, are not going to who are going to choose poor health choices, right? But what could you do at a population level if you set those structures and those systems up and you just made it easier for people to achieve them? And that's really, when you think of a policy perspective, you want policy that's gonna do that.
Yeah, I think one of the other things that is kind of unfortunate about the way that the online landscape is set up is like you kind of have these like panacea traps where like people will be like, oh, just do this one thing, and then like everything is gonna be fine. And what I liked about those pillars that you laid out is I think people need to understand that there are like multiple things that like go into your health, right? And so I have struggled with SIBO for a few years now, and it seems like there are certain interventions that I'll do that work. But the stress piece has been something that I have become more aware of in the past couple of years, of like the influence of that, and that even if I'm eating well, and I do eat really well, like if I'm burdening my entire body with like a state of chronic stress, and that's kind of messing up like my gut, then it's not primarily like a nutrition thing. And so for people to be able to look at their health holistically, I think it's just so important.
I think it helps reduce some health anxiety too, because what I see a lot is just because of social media and like these like fear-based messaging about all the like individual things. I think a lot of people are just scared about everything. And so I think that understanding that it's like all of these different aspects go into your overall health, I think can help kind of reduce some of that, and just recognize that like, oh, it's actually like way more complicated and interactive than maybe just this one thing.
Now, one thing that is very confusing for people, so carnivore versus vegan. And so it almost like, I wasn't that familiar with like the debates around this a few years ago, and then I got more familiar, and it almost feels like a religion in some aspects of how polarizing it is. But you'll see people who will write entire books about the fact that eating carnivore has like completely healed them. And then here are like the 95,000 scientific studies that support carnivore. And then you'll have all the plant people who will say the same exact thing. And I think if there's one thing that's confusing for me the most at a nutrition level, it is that. So how would you help people understand what's going on there?
It's hard. let me take a chance at it. I think that there's many different diets out there. You can find a diet book for pretty much any random way of eating. There's like fruitarians who only eat fruit. There's obviously vegans who don't eat animal products. And then you go to the opposite extreme and it's like carnivores who only eat meat products. And I think that a lot of times when you start one of these very restrictive diets, a lot of people will see like benefits of them, no matter what it is, because what they do is they cut out all of the food that's not serving them, right? These low nutrient, ultra processed foods. They stop eating so much added sugar, so much sodium, and they start to feel better. And maybe they have some sort of underlying issue that maybe an autoimmune issue or something like that, and then they start to feel better. And then they say, this everyone should be on this diet. And that's the thing, is that like, it's not, you don't necessarily know. We don't have good like trials that say it's because of this particular restrictive diet that these people are feeling better. And so I think that when you're thinking about like, what's the best dietary eating pattern, like it's just not that complicated. And again, I'm thinking on a population level here. We are not eating in a way that evidence says that we should be eating. And so we really need to just like focus more on eating more whole-based, fiber-rich, foods for the most part. This is on a population level. And kind of like, this is kind of noise, like all of these. It's not that like a vegan diet is a bit different because it kind of like encompasses a lot of different whole foods. I think a carnivore diet, I don't actually know much about it. I think it's just meat. Is that right?
But basically, and meat and fats and butter and other stuff.
Yeah, I mean, I'd be concerned about long-term health consequences of that, just from everything that we've known. I've never seen any trials that look at it long-term. But yeah, I think that people should just be judicious with the amount of information that they're consuming, kind of, again, in the margins, and looking at like, obviously those are two hugely different eating styles, but the kind of underlying feature of them is you're not over consuming calories. You're not eating too many low nutrient, ultra processed foods. You're not eating too much sugar. And so people are going to feel better.
Now, is it a matter of like in the short term, there's something going on? This is where like people get into like precision nutrition and like just so tailored to the individual on what their specific needs are at a specific point in their life.
Yeah.
Is it possible that either meat or plants could be aggravating you for some sort of reason at a particular point, and because you went full on in one direction, it helped you get out of a rut or a state of? Is that where potentially some of the evidence would be in the short term, at least?
It's possible. It's anything's possible, certainly. Like for example, some people can have some issues that they are aggravated by, certain vegetables, for example. And so, if you remove those from your diet, if you just remove everything, you don't necessarily know what was actually the trigger for somebody. And so this gets more on the personalized nutrition side of things. Like we wouldn't at a population level be recommending any of these diets for people. But on the precision nutrition, like on the individual, it's possible that you're just eliminating something that was causing you particular issues and you're not really sure what it was. And when you just kind of do a complete elimination. And so, when you work with like a nutrition professional, they can kind of help you with an elimination diet and figure out, what's the trigger for you, and then start implementing more food so that you can have a more varied kind of holistic diet.
One other thing I've thought about in terms of evolution and thousands of years ago, it's not like every society throughout history had the same level of access to the same foods. Like a hunter-gatherer society, right? If they're just like hunting and they're just like eating meat, it's not like they're picking out broccoli out of the ground and then cooking it. And so I would assume that they were probably predominantly eating a meat-based diet, and then you might have other aspects of the world where they were just eating plants because like that's all they could, and maybe they would get a little fish in or something like that. And so this idea that, I don't know, but do you have thoughts there in terms of like the long-term viability of just eating what's available to you?
Yeah, I mean, we see that with lactose intolerance too. So we see like in populations that have historically consumed a lot of dairy, they have less lactose intolerance than other populations that didn't consume a lot of dairy. So certainly there's an aspect there. I think in the US, it's tough because we're so like commingled, all of our genetics. So we don't have the same regional aspects of that. And but when you look kind of globally at like dietary eating patterns, there's some variation like that, certainly. And then there's also like some really like key big pillars that kind of transcend all of these different areas when we look at dietary eating patterns that are most healthful for populations. You hear about the Mediterranean diet a lot, and that's simply like eating more kind of like whole foods, fresh fruits and vegetables, these mono and polyunsaturated fatty acids, eating fish, eating meat minimally, like saturated fat from meats minimally. And those are the dietary eating styles that we have the best evidence for from a population level. But I think it'd be really interesting to kind of like look at do trials and look and like fun nutrition science research so that we could do some more trials looking at, okay, people in this population, is this dietary eating pattern maybe better than this one? And that would be really interesting. I think people forget like how we've only been conducting research the way we have for a very short amount of time in like history.
Like 100 years.
Yeah, like 100 plus years. Yeah. And look at how far we've come, which is incredible. I mean, we've doubled global life expectancy in the last 150 years with the scientific method and with scientific research. But like we have a long way to go, and particularly in the nutrition science, I like to call it like a baby science. We could be funding some of these trials that look at some of those questions that you're saying and doing more of them. We don't have great data on that right now. So we kind of have good data on like dietary eating styles that we've seen across the world be beneficial.
Yeah, it started with William Atwater. Like it was kind of one of the earliest in terms of like coming up. Like, I did research into this. It was like 1910 or like 1915 where like modern sort of like nutrition research started to come in. But prior to that, I mean, in the 1800s, like nobody really knew any of this stuff.
Well, all of the vitamins were kind of we just found those out in the 20th century.
Yeah.
They just were able to figure out like, oh, vitamin C and vitamin D. Vitamin C, they found out a long time ago that that was the cure for scurvy, but they didn't know it was vitamin C. They just figured out that it was like lemons, whatever was in lemon juice was curing scurvy, which was like this issue on boats, like sailors. A lot of what do you call the people that go out on boats? Sailors, right?
Yeah.
Yeah. So sailors, like a big proportion of them would die when they would go out on these voyages for like weeks at a time, and they didn't understand why. There was like no explanation. And they started figuring out, okay, because they didn't have any vegetables or fruits on the boat. And so they started figuring out if we could just put lemons on the boat and they would just suck the lemon juice, people didn't get scurvy. And so that was like the first kind of nutrition science experiment with not even realizing it was an experiment. And then it was a long time later when they actually were able to identify that it was vitamin C actually preventing scurvy. But yeah, we just kind of isolated and realized what vitamins were in the early 1900s. And so nutrition science has all kind of spawned from there.
Yeah. No, I think it's interesting what you said about the long-term kind of studies about carnivore specifically, because it's one thing. And we had another doctor that had brought this up, and I was like, oh, I hadn't even thought about that. It's like you might get a result in a 5-year period for a certain thing, but how does that scale over like a 30-year, 50-year period or your entire lifetime if you continue eating a particular way?
Yeah.
Is an interesting part. And so I don't think that, with all this awareness around like additives and the food companies and big pharma and whatever, I feel like that's just one piece of the equation. I think the other piece really is huge, has to do with like there's so many health influencers online, and this carnivore and vegan thing and meat and vegetables, because you'll have people who are like fit, I guess their appearance like incredibly ripped or something. Mm-hmm. And if you really think about what's actually required to maintain that appearance, like they're sort of presented as a model of health, but they must be eating like so much meat all of the time, particularly men, to get to be a particular size. And that's sort of presented as health. But then is that overeating? You're eating just so much meat. Is that even good for you? I don't know if you have a take on that.
I can just tell you what the evidence shows, and what the evidence shows is that the best dietary eating style is for ourselves and for the planet is less meat overall. I think we don't have a Not for everyone, but on a population level, we eat a lot of meat. And so we're not like deficient in meat as a country in terms of when we're looking at the dietary patterns and why we're unhealthy. It's not a deficiency of meat. And so, if you look at long-term health outcomes, we just don't have good long-term health outcome data. And what the hypothesis would be on what we know to be true is that it likely is not beneficial in the long term for someone's health. That would be what pretty much anyone who's ever looked at the actual data would say. And so there'd be a concern there. And you see this with a lot of people who have gone carnivore and they have these health issues and then they add fruit to their diet. And they're like, well, I'm going to start taking fruit because, I'm not feeling well or I'm having this issue.
Yeah.
And so, I would just caution against kind of these anecdotes where you see like a big person online, like a big muscular person online who has eaten this type of way. Like one, maybe they were already big and muscular and then they started eating this way and it's not actually that, which happens a lot of times in the supplement industry. It happens in the skincare industry because I get fed that all the time. And it's like, oh, I have this beautiful skin because of this new product that just came out. And you look at like pictures of 4 years ago and they also had beautiful skin. So that's kind of like a marketing thing. But I would also just caution that, forever until about 150 years ago, we kind of relied on these anecdotes to make decisions. And it's not that those are not without value. They certainly are. But we certainly were living half the amount of time than we are now back then. And so just remembering that an evidence base is important to kind of look at when we're making health decisions for ourselves and the people we love.
Yeah, I mean, it's the crux of the conversation varies so deeply based on someone's amount of wealth because on one part of this, like we were talking about, like you might be hitting a part of the population that just like is poor, doesn't have that much money, and so some of these things are like a luxury conversation. But then you hit this other piece of society where like maybe they have a little bit more money and now they're like all into investing in their appearance.
Yeah.
And so they get into this thing about their appearance versus their health and like how to like balance those two things. And there's just been such an explosion in fitness influencers. And I'm just like, I don't know what's required to actually, like, I don't think just going to the gym would necessarily produce some of these appearances. Obviously, there's steroids and other things that go into it, but I don't know. Someone like The Rock, for example, is probably eating like 8,000 calories a day, which is like an enormous amount of food,
Yeah, I mean, I think that if you had like a fitness expert on here, they would tell you that like what is required to be like super lean and fit is not actually the same as what's required for longevity.
Yeah.
And my brother did a physique competition one time and like what he did to his body, I was appalled. I was like, what do you mean particularly like right before he went on stage and he just like dehydrated his whole body to like go on stage. And I was like, that's not good for anyone. Like, I'm sure it's great for this like, competition that you're doing, but certainly not great for longevity. And actually, what's interesting is, what is in the evidence is that the more calories you consume and the like more your metabolism is working, actually is correlated with a shorter life expectancy. And so, it's like people who they're consuming fewer calories. They tend to be smaller. So their metabolism is not doing as much activity. They tend to live longer, which I always think about as someone who's tall.
Yeah. No, because it's interesting because so much has been made about the obesity crisis. And then the elephant in the room when I think about these things is like, okay, well, we associate the obesity crisis. Obviously, that produces adverse health outcomes. And that's all fat. But if you're eating 6,000, 7,000, 8,000 calories a day, you're still getting bigger. It's not fat, but it's muscle. Does that produce like good health outcomes? And so I don't know. I think some of the things that are being presented to people, and obviously they want to like aesthetically look a certain way. I'm like, I don't know, this could be dangerous.
Yeah.
So
yeah, I don't know. I'm actually not on that side of social media, seeing a lot of this. So I don't have great answers.
Yeah. We've covered so much ground. I think it begs the question, like, do you think it's possible for someone to take their health in their hands today with the aspects of public health that are at play?
Yeah, certainly. And we certainly see that happening all of the time. I think, there's certainly people who are overcoming all of the barriers. You have the outliers. I think what I want is for us to kind of like reframe the energy that we give to some of this, and we stop kind of expecting us to, on an individual level, overcome systemic and structural issues, and just channel some of that energy into advocating for different structures and systems. Because, the thing is that we have had no shortage of personal health messaging over the last 4 decades, right? I mean, you go back to the 80s and you see the magazines that are like, take control of your health and lose weight and lose 10 pounds in 10 days. Those like 80s, 90s magazines, they were awful. But here's your exercise routine. We've had presidential administrations with, the Bush administration did a whole Healthier Us campaign that was all about personal responsibility and taking back control of your health. The Obama administration did Let's Move, and they had some structural change in there, but a big part of it was kind of like take control of your health, move your body. Now we have this, I think they're calling it Take Back Your Health campaign under this administration. And so this is not a new idea that we should be like taking control of our health. We've had this messaging for many decades, and our health currently is obviously with lifestyle-related chronic disease has not improved. And in fact, it's gotten worse. And so I just would challenge us all to think about how perhaps we should funnel some of that energy into realizing that these individual behaviors at a population level just aren't going to overcome a lot of the systems and structures that are set up for a lot of us to fail. And so helping to advocate for changes there, I think can actually help improve health at a population level.
If you could, you mentioned the universal healthcare. If you could vision cast around that, like what would you like to see with like any sort of changes, the way that the healthcare system is and how it could benefit all people?
I think that expanding access to healthcare. So people don't have to make a decision on, should I take this ambulance to the hospital or not because I can't afford the care? Should I, I'm having these like heart pains, but I don't have coverage. So I don't have $400 or $100 to spend on like a visit. So I'm not going to go to the doctor. I've been having this chronic pain for 4 months, but I don't have health insurance, so I'm not going to go to the doctor. I want to see all of those barriers removed. I want to see those people be able to go to a physician and be able to have a screening or get checked out. And so I think when we devise a healthcare system, it's making sure everyone has at least baseline access to healthcare. And then, again, you can have structures on top of that can be private or whatever it is, but making sure everyone has access and expanding access, because we know from the data that when you expand access to healthcare, health outcomes improve and it's cost effective. So from a healthcare perspective, that's what I'd like to see, specifically because it can improve health outcomes for people and at the population level, and particularly for people struggling most with their health, which are oftentimes the people who don't have healthcare access.
Is there a country that you admire, maybe even one that like people can look up and just see the fruits of a certain system playing out over a population level?
Well, a healthcare system or just their systems in general?
Well, both. Yeah.
Yeah. I think that when you look at like the happiest and healthiest countries, obviously you can't not talk about Scandinavian countries. They're often which is wild to me because they don't get a lot of sun up there.
Yeah.
And so
weird.
I don't understand as someone who loves the sun. But they certainly have very strong public health systems. So I don't know if there's a perfect system out there. I think America, we're on the forefront of innovation. Maybe we could devise the perfect system. But certainly we have a lot to learn from all of the other countries who have implemented these systems, and we can look at the pros and cons of each one of them and see what would be best here. And it's certainly not what we currently have, where millions of people are locked out of healthcare coverage altogether. We're paying exorbitant amounts. You mentioned the hospital bill that you get or the doctor's bill, and it's just why does this cost so much money? It's certainly not that system.
Yeah. Well, we've covered so much ground. I mean, this is just so comprehensive. And I think, just from a wellness and a public health standpoint, I think there's so much to kind of chew on and think about that you said. I think my last question really is if you imagine someone who feels discouraged, about the whole situation around public health or even wellness, like what sorts of things that would you say to them to help them reclaim their own agency and power in the situation?
I think action does a lot for overcoming kind of that, like, it's all too big, it's too much. So just like taking these small actions. So first of all, from a personal health perspective, I would say that and I kind of mentioned this earlier, but the vast majority of the messaging you see out there are not the major things impacting your health. So we spend, because it works really well with algorithms and the way that they're designed, we spend a lot of time kind of consuming content that is in the margins, as I like to say, right? It's like marginally maybe going to make health a little better if you have all of these like basic needs met. So I would just encourage people to make sure that they're covering those pillars of health first, right? Make sure you're meeting your nutrition recommendations. Make sure you're meeting your physical activity recommendations, getting 8 to 9 hours of sleep, and stress. I think stress is probably the most overlooked one because it's like you don't think about it as much and it's very easy to get overstressed in our current culture.
Yeah.
And so like even myself, like I'm talking to myself right now, but like figuring out ways to decrease our stress. And, whether that's mindfulness, it's going for a walk, doing those things. Once you have that done, you'll start to feel like better, right, about things. And then like you can still kind of like look at some of the margin stuff, but just know that like all of that health anxiety you're having is because that works really well on social media. So kind of identifying that, staying kind of like centered on those basic pillars, and then advocate for structural change. So whatever it is, if you want to see our food system changed, kind of advocate for that. If you want to see a better built environment, advocate for infrastructure bills that are going to help bring, and even on your local level, like bringing sidewalks and kind of cleaning up parks, things like that. Advocating for those really big policy levers, I think can be really helpful. And change does happen when people push for change.
Beautiful. Well, thank you so much for being here today. I really appreciate it.
Thanks so much for having me. Yeah. Appreciate the conversation.